We have a bill before us in the floor to deal with opioids and the heroin crisis. It's a crisis that hit Illinois and hit it hard. Across Illinois, we've suffered from 1,700 drug overdose deaths in 2014, a 30% increase over 2010. 40% were associated with heroin. Last October in Chicago, in a weekend, we had 74 people die from fentanyl-laced heroin overdoses. In 72 hours, 74 people. The Chicago metro area ranked first in the country, sadly, for the total number of emergency department heroin visits, higher than New York, with 3 times the population. The epidemic demands our attention. We need a comprehensive solution. First, look at pharma. Flooding America with opioids. OxyContin, hydrocodone, similar opioid products. In the last year, there was a calculation. There were some 14 billion opioid pills manufactured by pharmaceutical companies in America. That's enough to give every adult person in America a 1-month prescription of opioids. Well, naturally, everyone doesn't need it, but they keep generating these volumes because the demand is there, not for medicinal purposes, sadly, but for narcotic purposes. So the pharmaceutical industry has a responsibility, and doctors have a responsibility. Those pills don't move from the pharmaceutical companies to the end user, except with a doctor and a pharmacy in most instances. Many doctors are too loose in their prescriptions when it comes to painkillers, and they prescribe too many pills. I guess somebody makes more money that way, or maybe a doctor isn't bothered on weekends that way, but sadly it puts in circulation a lot of pills that aren't really needed by people who are suffering from pain. And some pharmacies know exactly what's going on. As people walk in with script after script for these opioids, they fill them without a question, and many states don't have laws, local laws, to monitor these sales. Then comes the devastation of opioid addiction, followed on with heroin addiction. Seen it across my state. There isn't a city too small, or a suburb too wealthy, or any corner of my state that hasn't been touched by this crisis. It's everywhere. And many of the kids that I've seen at these roundtables who've survived it and tell their heroic stories of coming back from heroin addiction, you look in their eyes and think, I would never have picked that kid out of a high school class as a heroin addict. Some of them have been addicts for years before they finally get the treatment that they need. This bill before us is a step in the right direction. It requires establishing federal interagency task force to develop best practices for pain management and pain medication prescribing, a national drug awareness campaign on the risks of opioid abuse, grants to state, local nonprofits to address opioid abuse and fund treatment alternatives. Let me just say as well, one of the things that has helped is the fact that years ago, here in the United States Senate, 2 of my colleagues who no longer serve really did something historic. One was Paul Wellstone of Minnesota, who had passed away in an airplane crash, and the other, Pete Domenici, a retired senator from New Mexico. They required that every health insurance policy in America cover 2 things that weren't covered by many. One, mental health counseling, and the other, substance abuse treatment. We built that into Obamacare, so that if you buy a health insurance policy in America today, it covers substance abuse treatment as well as mental health counseling. Luckily, for many of the families, when their kids end up being addicted, they can turn to their health insurance, and their health insurance can help pay for substance abuse treatment. We need other sources as well for treatment when it comes to Medicaid. But for those who say they want to repeal Obamacare and get rid of it, that's another provision. You have to ask them, really? You want to get rid of the requirement that health insurance policies in America cover mental health counseling and substance abuse treatment? I think it's important that we have it. I'm not sure what we do without it.